Hello, my name is William Palmer. I'm an assistant professor of medicine in the Division of Gastroenterology and Hepatology at Mayo Clinic in Jacksonville, Florida. I'm here today to talk with you about hereditary hemochromatosis, also known as genetic iron overload disease. So, let's talk about hereditary hemochromatosis, or hemochromatosis for short. In essence, this is a disease where the patient stores too much iron. The disease can be silent, or in some cases, can cause significant medical problems. The diagnosis of hemochromatosis is largely made with blood tests. Treatment, along with close monitoring, are important in order to prevent complications related to hemochromatosis. When we talk about hemochromatosis, we have to talk about hepcidin. The abnormal production of hepcidin, which is an iron-regulating protein, causes hemochromatosis. Hepcidin is a liver protein that controls iron storage, as well as iron absorption in the small bowel. Abnormal hepcidin production results in uncontrolled iron absorption from the bowel and deposition of excess iron into body organs, which include the liver, heart, and pancreas. Mutations in genes that control hepcidin regulation cause hemochromatosis, not the hepcidin genes themselves. The most common version of hemochromatosis comes from what we call HFE-associated hemochromatosis. Mutations in the HFE gene that regulates hepcidin cause this condition. Over 80% of HFE-associated hemochromatosis cases are due to a patient having two copies of a gene mutation called C282Y. Having two copies of a gene is also called homozygous. Homozygous C282Y patients are almost always Northern European in ancestry, with the mutation occurring in about 1 out of every 250 people with this heritage. Individuals with only one copy of C282Y may have another gene mutation that causes hemochromatosis, such as H63D or S65C. A combination of two gene mutations like this is called compound heterozygote. So, who should be screened for hemochromatosis? Any man with Northern European ancestry who is over the age of 18 years old should be screened. First-degree relatives of patients with hemochromatosis over the age of 18 should be screened. Sometimes, patients have gene mutations for hemochromatosis, but do not manifest the disease. This is called penetrance. Patients without penetrance are monitored regularly with blood labs and clinical assessment. It is important to note that children are not typically screened, as the disease is unlikely to affect them in early life. Now, let's talk about the signs and symptoms of hemochromatosis. Excess iron deposition in the body can cause a variety of issues, including fatigue, joint pain, yellowing or bronzing of the skin, or leg swelling. The most common organs involved by hemochromatosis include the liver, which can lead to cirrhosis or liver cancer, the heart, which can lead to heart failure, the gonads or testes, which can lead to hormone deficiency, the pancreas, which can lead to diabetes, the joints, which can lead to arthritis, and the skin, which can lead to bronzing of the skin. When we want to screen patients for hemochromatosis, we start with some basic blood tests, one called serum ferritin and one called serum transferrin. If those tests suggest the possibility of hemochromatosis, a genetic test panel is performed to screen for the most common gene mutations associated with hemochromatosis. We know from research studies that C282Y homozygous individuals with a serum ferritin level higher than 1,000 have an increased risk of complications from hemochromatosis. Even though our blood and gene tests for hemochromatosis are quite good, sometimes we need to perform a liver biopsy to confirm the diagnosis or stage the disease. A liver biopsy is an outpatient procedure where a physician uses an ultrasound machine and a needle to take a small sample of liver tissue. The sample is then analyzed for both excess iron deposition as well as to assess for any liver damage that has occurred from the iron overload. Though the procedure is quite safe, there is a small risk of bleeding associated with a liver biopsy. Through advances in medical technology, at Mayo Clinic we now have several alternatives to liver biopsy that we can use in certain cases to assess for both iron overload as well as scar tissue formation in the affected organs. Non-invasive elastographic tests assess for liver damage without the need for an invasive procedure. We have two available. One is called FibroScan and one is called MR elastography. Both of these tests employ a technology which uses sound waves to assess for scar tissue in the liver. The procedure is completely pain-free and carries no risk or side effects. A small group of patients can develop hemochromatosis from more uncommon gene mutations, which include the genes shown here. At Mayo Clinic, we can test for these mutations. The primary treatment of hemochromatosis is bloodletting, also called therapeutic phlebotomy. By removing a patient's blood in a controlled fashion, we can reduce the amount of total iron in their body. It's important to note that this procedure can reverse many, but not all, of the complications of hemochromatosis. Phlebotomy is initially performed no more than once per week to remove about 1 pint of blood at each session. We perform blood tests during these phlebotomies to monitor the patient's iron levels. As the iron levels improve, the phlebotomies are performed less frequently. Thankfully, at many centers, blood removed from hemochromatosis patients can be safely used at blood banks to treat other patients in need of a blood transfusion. Some patients do not tolerate therapeutic phlebotomies because of symptoms related to their low blood counts. These patients may require medication to reduce their iron levels. These medications are called iron chelators and can have side effects of their own that should be reviewed with your doctor prior to starting them. Diets that limit excess iron and vitamin C are important for hemochromatosis patients, and consulting with a certified nutritionist specializing in this disease can be helpful. In patients with liver failure from hemochromatosis, liver transplantation can be a life-saving surgery. And further, the liver transplantation surgery also cures the hemochromatosis. At Mayo Clinic in Florida, we are fortunate to have one of the best and most award-winning liver transplant centers in the world. The Liver Transplant Center has performed nearly 3,000 liver transplants since 1998 and has one of the shortest transplant list wait times in the United States. At our Hereditary Hemochromatosis Clinic at Mayo Clinic in Florida, our mission is twofold. One, to provide state-of-the-art diagnostics, treatments, and education to patients with iron overload disease. And two, to perform research to improve the lives of hemochromatosis patients and their families. At our Hereditary Hemochromatosis Clinic, we provide a comprehensive evaluation and treatment plan, which can be completed in 1 to 2 days, all done at one center. Patients will meet with a hemochromatosis specialist, a certified nutritionist, and a genetic counselor during their evaluation. Patients will undergo blood testing, imaging tests, and other pertinent assessments. Therapeutic phlebotomies can be performed at our center or at the patient's local lab. Testing will include blood tests for iron, gene mutations, and metabolic tests, as well as imaging tests of the abdomen, liver, and heart. Other individualized testing will be performed based on the patient's medical history and clinical presentation. Patients who would like to make an appointment at our Hereditary Hemochromatosis Clinic should call the number shown here. Thank you so much for your time.